Thank you for staying tuned to Sunrise at Sea right here on CTV. Welcome back from that short break. My name is Apollo Sarah, and now I am joined by Mr. Emmanuel Ainebiona, and he's the Senior Public Relations Officer at the Ministry of Health. Good morning, sir.
Good morning to you.
And welcome to the show.
Viewers.
Welcome to the Twitter Jabs.
Thank you.
Well, today we are discussing the termination of contract workers by the Ministry of Health, and that people have a lot of questions. So let's dive right into it. For my first question is, first give us the status of the healthcare sector right here in Uganda. Can we really afford to lay off medical workers if the World Health Organization is stating statistics saying that there are 2 doctors per 1,000 people here in Uganda? And also and that is Dr. Samuel Oledo, that is the president of the Uganda Medical Association, did say that there's a 40% staff gap in the public referral hospitals. So what do you have to say about that?
Thank you very much. We are undergoing restructuring of the health facilities, and restructuring means that there are new positions that will be created.
Yes.
There are those ones that will be phased out for better service delivery. So it's not per se that we are not doing something. We are doing something to ensure that we have service delivery that caters for all Ugandans seeking for health services within our facilities. And for the case of the issue of those ones that have been stopped from working, it was purposely that they had been hired to attend to COVID patients on contract. And given that now the situation has a bit, the cases have a bit reduced, and we have no patients largely admitted in COVID treatment units, we thought it necessary by taking a hard decision to terminate those ones that had been hired on contract, because there was no wage to pay their salaries, so it was not sustainable.
All right.
Yes.
So I was looking through the website of the Ministry of Health, and it did say that confirmed cases are at 163,301, while deaths are at 3,588. But it did not show the number of new cases. So are you trying to say that Uganda is now COVID-free? We do not have
we have a number of people who are testing, but they are in double digit and below 20.
All right.
So the cases that require hospitalizations have really drastically reduced.
Okay.
So not many are in treatment.
All right.
If there are so many, you find like Murago now has less than 10.
Okay.
Yes.
All right. In your statement to the press, you did say that arrears will be paid, and you said in a few days.
Yes, already some have received their arrears.
Yes.
And we continue to process the allowances.
Okay.
Yes.
You also did not mention how much the Ministry of Health owes these contract workers.
It was 3 months plus 1 month in lieu of termination.
All right.
Because any contract has terms that in case of any of the parties is going to abruptly ends their services, they have to cater for some provisions.
All right.
So all those will be, as stated in their contracts, will be fulfilled.
All right. Yes. And then you also did mention that you are going to vet some of the contract workers and then keep those that have desirable qualifications. So what desirable qualifications are these?
We will do an analysis to know which positions have wage.
Okay.
Because for you to keep someone, there must be a position that has wage already existent. So those positions that are critical, like intensive care staff, people who work in the ICU, we will review and see those ones who can. Of the available wage, those ones we can keep.
Yes.
But also in case of our desire would be to absorb all of them. So in an event that funds are realized to cater for their wage, and these specific staff who really sacrificed during COVID will be given first priority.
Okay.
Yes.
But don't you think all of them sacrificed during the COVID-19
yes,
pandemic?
and there is no doubt about that.
Yes.
We really appreciate the services rendered to Ugandans and also to the Ministry of Health. We would not have succeeded in the fight against COVID without these staff.
Yes.
You know the stigma around COVID, so
Yes.
someone braving to be in the COVID treatment unit, really, no one can doubt their contribution.
And their sacrifice.
And their sacrifice. So in an event that there is any opening through the Health Service Commission, these staff will be given the first priority.
All right. Was there any consultation done with the stakeholders before this decision was made? I mean, if the ratio of doctor to say patients or people in the country is 2 to 1,000.
Yes,
I
there
mean,
was an effort to see whether we can have them,
Okay.
if we can get more funds, but unfortunately, the funds weren't available.
yes.
So that's why we were really pushed to take a hard decision.
Then how are you going to manage the staff gapping in hospitals?
As I told you, there is an ongoing restructuring,
Okay.
which will eventually result into recruitment. There's also a presidential directive to ensure that we have a doctor per sub-county.
Okay. One doctor.
Yes, at least at the sub-county level, because you know at the sub-county level we have health center 3s.
Yes.
In every sub-county. So we intend to recruit for all the sub-counties, and also the health center 4s need to have about 4 doctors.
Yes.
So all that, as the process concludes and funds are realized, there's an effort to ensure that we improve on the doctor to patient ratio.
All right.
Yes.
And then for my next question, I'd like to ask, the letter of termination was sent out on 18th March 2022, and they were to be terminated by the 30th of March. Was there any prior notice given before the 18th of March? Or they received it when they got the letters?
I really don't know, but what I really understand is that there were prior engagement, prior communication to their supervisors within the various COVID treatment units, because they were largely in regional referral hospitals. So there was prior engagement of their immediate supervisors.
All right.
As this decision was being taken.
Yes. Well, at the moment, China is experiencing a new wave, and actually Shanghai is now on lockdown. What happens in the event that a new wave, hits the country?
Yes, as I said, as and when need arises, currently we are working on a COVID stabilization strategy, which is a plan that is being costed.
Yes.
So we will seek resources through Parliament. If resources are appropriated in an event there is a threat, then we will have to immediately call back these people, because then there will be resources. But for now,
Yes.
there are no resources to cater for their
Yes.
wage, because their contracts were supposed to run until end of June.
Yes.
Yes.
All right. So do you have any message or remarks for the Uganda Medical Association, the Uganda Midwives Association, because these are organizations that have been greatly affected by this move by the Ministry of Health? So do you have any words that you'd like to share with them?
What I can call for calm and patience,
Okay.
and ensure that we continuously engage to see how best the various cadres affected of health workers can eventually get absorbed into the system
Okay.
for better service delivery. That is everyone's desire. So we'll continue engaging in dialogue to see how best we can have all these health workers absorbed into the system, to to ensure that we have better services delivered to Ugandans.
All right. Thank you so much, Mr. Emmanuel Aneviona, for joining me right here on the Twitter Jabs on Sunrise at Sea. Thank you so much. Your insights were very helpful, and I hope that they have, calmed anybody down. But do you have any closing remarks?
Yes, I want to appeal to each and everyone watching us is that COVID is still existent, and we need to ensure that we get out and get vaccinated. If you're due for your second dose, endeavor to take the second dose. Kampala has performed well in terms of first dose.
Okay.
We have had an over 100% uptake.
Wow.
So we expect those ones who took their first shot to take their second jab, because the percent is still around like 50%.
Yes.
For the second shot. And the elderly who are above 50 and those in the vulnerable groups, to ensure that they come out for their booster doses.
Yes.
Yes, so that is my appeal, and ensure that we continuously adhere to the public health measures instituted by the Ministry of Health to prevent the spread of COVID.
You've said in Kampala that people have been very receptive to getting the vaccination. What about in the outskirts of Kampala?
Yes, I've just returned from Kigezi.
Yes.
We had a media tour to pick stories and experiences of why Kigezi, for instance, is over 88%.
Yes.
And with some have also already had over 80% for the second dose.
Yes.
So Kigezi is doing well, Lango sub-region is doing well. We're having challenges in Karamoja and some parts of Acholi.
Yes.
So we appeal to the leaders in those places to ensure that they sensitize the population and also make vaccines available.
All right.
Such that people can get their shots.
Why isn't Karamoja and parts of Acholi not doing well?
Largely maybe because of, there has been insecurity in Karamoja.
Yes.
And also other factors which we continuously to address. And also there was some bit of hesitancy within Acholi based on some various remarks of certain leaders.
Yes.
Of which we continuously engage to ensure that the population have fully understanding of the benefits
of getting
the vaccination.
All right. Thank you so much, Mr. Emmanuel Aneviona.
Thank you for having
me.
And
thank you for joining me on this segment of the Twitter Jabs. But we have more coming up on Sunrise at Sea. Next up is our wellness, lifestyle, and beauty segment. And today we're talking in our wellness segment. We're going to be talking about financial discipline. You won't want to miss that conversation. Stay tuned. This is Sunrise at Sea.